Now to a story where the internet is bridging the divide between the city and the bush. The federal government plans to have a national system for shared electronic medical records in place by 2012.
But an Aboriginal health group in a remote part of the Northern Territory already has its own electronic system up and running. Sarah Everingham reports from the community of Kalkarinji in the northern Tanami Desert.
On most days, Aboriginal health worker Dee Hampton isn't in the clinic, but out visiting patients in her community of Kalkarinji.
Hello. Hello.
Hello.
Hello, Biddy. Hello, Jimmy.
The clinic staff are kept busy caring for Kalkarinji's hundreds of residents.
You got to come up and pick me up. Might be Saturday.
But Dee Hampton says using a new mobile computer is making her life much easier.
Okay, I'm just having a look at your sugar levels. It's easy to get information quickly out in the community while you're out there, instead of going from the clinic out the community then back again.
Turn this way, turn this way.
Kalkarinji might be remote, but when it comes to e-health, it's far ahead. The federal government is trying to develop a national e-health system, but thanks to funding from the Commonwealth, communities in this region have been sharing patients' electronic health records for years.
We're enabling people's health record to follow them around wherever they go. And once you've got that information, the clinicians, nurses, health workers, doctors now know, okay, this person's on this medication, so I won't be giving them another medication.
I just come to see if you're due for any recalls.
The local Aboriginal Controlled Health Board, Catherine West, is now using a new mobile device rather than a laptop for easier access to those health records in the field.
And you've still got Rosec with you?
It's particularly useful in Indigenous communities where patients are highly mobile and some are reluctant to attend the clinic.
Hey Benjamin, how you going?
The male health workers will go and see the men at their workplace and have a quiet word to them, just remind them that they haven't had a health check in the last 2 years. What we're providing people is the tools, the information to be able to remind the right people to come to the clinic when they need to.
The updated information is sent wirelessly from Kalkarinji to Sydney. It's then sent back to all 7 communities in the local area. Aboriginal health groups say electronic data recording provides a better picture of Indigenous health.
If they can actually get data to say, look, this is what the clinic's doing, these are the outcomes, so people's blood pressures are improving, or even if they're not, okay, what do we target, where do we go?
There's debate in Canberra about how to proceed with e-health, but here health groups say it is helping to close the gap. This system is now operating in several large communities in the Northern Territory, but Aboriginal health groups would like to see it spread much further.
It's got the potential to save lives, it's got the potential to widen the network of health to people. It's got the potential to save great money.
So I put a recall in for you, for the doctor next week.
Yep. Aboriginal Medical Services hope the National Broadband Network will help bring the system to more remote communities around the country. Sarah Everingham, ABC News, Kalkarinji.